Do you believe that just a few simple daily habits could lead to prostate enlargement? Are you curious to know what these habits are and whether you might be unknowingly practicing them, causing your prostate to silently suffer? Today, I'm going to tell you exactly 10 bad habits that weaken your prostate and bladder day by day, along with the simplest ways to change them. By the end, you'll understand how to stop prostate growth naturally and safely. Your prostate sits just under the bladder, and the urethra runs right through it. You can think of a donut with a straw in the middle. When the bladder is irritated or under pressure, it sends that stress straight to the prostate. Over time, that constant push and pull can make symptoms worse, even if the gland itself isn't huge yet. Prostate enlargement can cause symptoms like frequent urination, weak stream, or nighttime trips to the bathroom. Are you tired of these issues? Don't let the thought that enlarged prostate is just an old age disease mislead you. Even simple lifestyle adjustments like drinking water throughout the day, getting up every 30 minutes to move, and cutting caffeine after your first cup have evidence behind them for easing bladder irritation and nighttime urgency. Remember, your daily choices can move the needle. Alright, let's dive in. From the least harmful habit to the most dangerous one, the habits that most older men tend to overlook. We'll start with the one most men usually ignore, drinking too little water. Because the way you drink water and when can either calm your bladder or keep it on high alert all night. Number 10. Ignoring thirst and staying dehydrated. Picture Mr. David, 68. He hates the idea of drinking more water because it means more trips to the bathroom, so he sips coffee all morning, barely drinks in the afternoon, and then gets thirsty after dinner. He ends up guzzling fluids at night and pays for it at 1 a.m., 3 a.m., and 5 a.m. The next day, he sits for hours in his favorite chair to catch up on sleep, barely moves, and the cycle repeats. One of the mistakes David made was not drinking enough water throughout the day. This habit makes urine darker and more concentrated. That concentrated urine can irritate the bladder lining. Because the prostate sits just under the bladder, an irritated bladder often sends pressure and signals that can worsen prostate-related symptoms over time. This is why staying hydrated matters more than you might think. Study in the European Journal of Neurology shows links between low fluid intake and worse lower urinary tract symptoms, related issues like urinary infections and stones. Staying hydrated helps dilute urine and may lower irritation. You should aim to sip water regularly rather than chugging at night. A good visual cue is urine that's pale straw or light yellow. If it's dark like tea, you're likely underhydrated. If you're on fluid-restricted meds, check with your doctor first. Moving on to our bad habit number 9, which is sitting for long hours without movement. Sitting too long compresses the pelvic area and reduces local blood flow. Lower blood flow and weak pelvic muscles can make it harder to fully empty the bladder, and poor circulation can promote low-grade inflammation. Over weeks and months, that chronic state can contribute to urinary symptoms and aggravate prostate discomfort. Research shows uninterrupted sitting reduces blood flow in the lower limbs and impairs microcirculation. Long sedentary time is linked to higher inflammation and other health risks. Breaking sitting time up helps. Imagine your favorite TV chair. You watch the 6 p.m. news, then a show, then a movie, 4 hours straight. Little muscle movement, more pressure in the pelvic area, and next morning you feel sluggish and notice more urgency that day. Easy, safe tip for you is to set a timer so you can stand and walk for 1 to 2 minutes every 30 minutes. Even a short walk to the kitchen, a couple of gentle stretches, or marching on the spot resets circulation and takes pressure off the pelvis. Here's a habit most men never think twice about: Yet it could be the reason you're making those frustrating bathroom trips all day and all night. Let's talk about your daily cup of coffee. Number 8. If you're drinking too much coffee, you're doing it wrong. Caffeine is a mild diuretic and can increase bladder activity. For sensitive bladders or men with prostate-related urinary symptoms, lots of caffeine can mean more urgency, more trips to the bathroom, and more irritation. Some controlled studies show cutting caffeine can reduce frequency and urgency in people with overactive bladders. So, the easiest and safest tip is to keep the first cup of the day if it's important to you, but try decaf or herbal tea after that. Track how you feel for a week. If your trips to the bathroom drop, caffeine was probably playing a role. Number 7. The next bad habit on the list is eating spicy and processed foods daily. Spicy foods and ultra-processed foods can worsen bladder irritation for some people and promote systemic inflammation for others. Processed foods often carry excess sodium, unhealthy fats, and preservatives. These factors link to inflammation and poorer metabolic health, which in turn can affect prostate health. A daily habit of hot sauces, frequent fast food dinners, and packaged snacks can quietly raise inflammation and disrupt hormones over months. Switching a few meals per week to fresh vegetables, berries, and healthy fats can ease that burden. At first, you can try a 3-day test. Reduce spicy and packaged foods, and eat more whole foods like leafy greens, berries, fish, nuts. Notice bladder comfort and nightly trips. Small swaps work better than all or nothing. Now, food isn't the only everyday choice that can quietly work against you. There's another habit many men overlook, and it doesn't happen in the kitchen, but in the bathroom. Enlarged prostate can cause urinary symptoms, including a frequent and urgent need to urinate. However, many men tend to hold in their urine, thinking that this habit probably doesn't cause any harm. Actually, it can quietly turn into one of the most dangerous for your bladder and prostate. Every time you hold it in, you're not building strength, you're building stress. And over time, that stress can invite infection, irritation, and lasting damage you never saw coming. Number 6. Holding your urine for too long. Regularly delaying the bathroom stretches the bladder, increases residual urine after voiding, and can leave stagnant urine that invites bacteria and irritation. Over time, incomplete emptying can raise the chance of infections and persistent bladder irritation, both bad for prostate comfort. Recent reviews find holding urine is associated with urinary tract infections, risk, and bladder dysfunction. So, what if you have to skip a restroom because you're driving or you postpone going to sleep? Do it occasionally? Not a big deal, but do it often? Your bladder and prostate start paying the price. When you feel the urge, go. Don't train yourself to hold it routinely as you might have when you were younger, because according to statistics from the National Institute of Diabetes and Digestive and Kidney Diseases, about 29 to 33% of men aged 65 and older have benign prostatic hyperplasia. If you're purposely delaying urination to sleep through the night, adjust your daytime fluid intake and consult a clinician for a tailored plan. Number 5. Smoking or inhaling secondhand smoke is also bad for your prostate. Smoking harms circulation and increases oxidative stress, both of which interfere with tissue healing and increase inflammation. While studies differ on smoking's direct link to benign prostate enlargement incidence, many show smoking raises the chances of prostate inflammation and is linked to worse prostate cancer outcomes. Quitting improves circulation and reduces inflammation over weeks to months. If you smoke, ask your clinician about quitting aids like nicotine replacement, counseling, prescription medicines. Even long-term quitters benefit. Circulation and inflammation markers often improve within weeks. You should also avoid secondhand smoke when possible. Now that we understand why frequent smoking can lead to prostate enlargement, let's explore the next habit that may silently force you to endure the uncomfortable symptoms of this condition. We are getting to bad habit number 4, skipping regular health screenings. The prostate can grow silently. Routine checks like discussing symptoms with doctors, digital rectal exam, and prostate-specific antigen testing when appropriate help catch problems early before they become severe. Skipping checkups means losing the chance to manage or reverse small problems with lifestyle or simple treatments. Clinical guidelines stress talking with a doctor about prostate health after age 50 or earlier for higher risk men. Make one appointment a year to review prostate health, medications, and symptoms. If you notice new problems like weak stream, pain, blood in urine, don't wait and call your clinician. Early discussion expands your options. Before we get to the most dangerous habit in a few minutes, let's find out how that juicy steak or crispy bacon you love might be feeding more than your appetite. Number 3, eating too much red and processed meat. Several studies link frequent red and processed meat to higher inflammation markers and to higher risk of prostate problems in some populations. Processed meats also carry preservatives and compounds formed during high heat cooking that are associated with cancer risks. Replacing some red meat with fish, legumes, or plant-based meals can help lower inflammation and support prostate health. Loving a daily bacon and steak breakfast? Try making 2 or 3 meat-free meals a week instead. Swap one dinner a week for grilled salmon and a big veggie salad, and your body will notice the difference. You know what happens when you eat too much red and processed meat? It packs on belly fat, and that's our number 2 bad habit for prostate health. Belly fat isn't just cosmetic. Abdominal fat releases chemicals that increase inflammation and change hormone balance, like lowering testosterone and altering insulin metabolism. Multiple studies show central obesity and higher waist circumference are linked to larger prostate volume and worse urinary symptoms. Losing even a few pounds often reduces urinary symptoms. A simple plan, daily 20-30 minute walks, eat smaller portions, less sugary snacks, can slowly shrink waist size. Many men report fewer nighttime trips after modest weight loss. Even a loss of 3 to 5% of body weight can produce health benefits. Finally, we've reached the most dangerous bad habit that silently harms men's prostate health. Can you guess what it is? Number 1, not managing chronic stress. Chronic stress keeps cortisol and stress pathways activated. Over time, this promotes inflammation, tightens pelvic muscles, and may worsen prostate symptoms. In some studies, stress has been linked to prostatic inflammation and worse lower urinary tract symptoms. This habit is often invisible but powerful, which is why it's the most dangerous habit. Thinking about Mr. Adam, who carries constant worries about money and family. He sleeps poorly, feels tense, and notices urinary urgency even when nothing else changed. When he begins 10 minutes of daily breathing, a short walk, and weekend social time, his sleep improves and urgency softens. So the easy tip here is to start with tiny, reliable routines. 5 to 10 minutes of deep breathing each morning, light stretching, short social phone calls, and a consistent sleep schedule. Mind-body practices like mindfulness or light yoga reduce stress and have measurable benefits for inflammation and hormone balance. If anxiety or depression is present, seek help from a mental health professional. Managing mental health is prostate health too. You've just heard the 10 everyday habits that can slowly, silently enlarge your prostate. And here's the truth. These aren't just small tweaks. They're powerful steps that can save you years of discomfort, restless nights, and even stronger medical treatments down the line. The good news? You don't have to fix everything at once. Start with just one habit this week, maybe sipping water throughout the day, standing up every half hour, or switching your second cup of coffee to herbal tea. Small, steady changes add up, and your body will thank you later. Your prostate health is in your hands more than you realize. If this episode gave you value, do me a favor. Hit that subscribe button so you never miss the next health tip that could change your daily life. Click like. It tells YouTube this is worth sharing with more men who need this message. And drop a comment below. Which one of these 10 habits are you going to work on this week? I'd love to hear from you. Thanks for listening, and I'll see you in the next episode.